Maiduguri.
Health personnel in terror-stricken regions of northern Nigeria are in dire need of all the help they can get to cater to health needs of those in rural communities. Top of that list is rehabilitation of health centers and adequate staff. Sarah Ayeku takes us to some communities in Zamfara state where health workers are trying to cater for women and children running from bandits and dealing with irregularities plaguing the sector.
Bandit attacks in Zamfara state keep depleting medical facilities, draining health workers, and forcing those in rural communities up north to access overstretched health facilities. This is the maternal and child health facility in Maru local government, managed by Amina Abdullahi.
We stopped going to insecurity areas, but most of them are coming to us for assistance. Immunization, family planning, ANC. Yes, even our director told us that we should stop going to insecurity area.
For 28 years, she has worked as a health worker at the facility, first as an assistant and now the officer in charge of MCH Maru.
We have at least 18 communities that are under MCH. So we manage about, let's say, 20,000, because we have a lot of immigrants that are inside Maru by now.
This is a maternal and child health facility without a delivery room, wards, laboratory, or even a pit latrine to accommodate the number of women who come here in droves for antenatal care and ready-to-use therapeutic foods. When there is an emergency, Amina uses a cycling ambulance to transport patients to the general hospital, a facility about 2 to 3 kilometers away from town.
We have a lot of women that are coming to our facility, but we don't have enough. We have space, but we don't have wards to help them. So there's nothing we can do. Anyone that is seeking for assistance, we just transfer them to general hospital. We only conduct ANC here. Our borehole is condemned. I always, every day, buy water. Drinking water, for hand washing, everything. We don't have labor room. We had a lot of equipment, but we don't have wards. We don't have enough rooms.
Outside the facility are children, most of them girls, laboring to use the hand pump. These girls fetch from this water pump, and then going to town. Water is unsafe for drinking, but the girls have no choice. They want to make some extra cash. At Kotarkoshi Primary Health Center, irregularities and corrupt practices in the health sector jeopardize the hard work of a few health workers on call. In this facility, there are about 46 health workers, but they can't run a 24-hour shift at the hospital. Only a few are on call. The others don't resume for duty. They are just on paper.
In terms of infrastructure and equipment, I think we are pairing quite well with other states. We need more actually, but then I think the government has did very well in terms of infrastructure.
The health workers are waiting for the government to implement the policies that will make healthcare more accessible to the people and perhaps profitable for health workers. Sarah Ayeku, TVC News, Bungudu.